generalized body swelling, it is also called edema. Edema is also among the most common presentation of a patient. Edema is clinically apparent increase in the volume of the interstitial fluid due to an imbalance on the Starling force. I hope you remember the Starling forces from your preclinical studies. This Starling force is a force which controls the total body water. The total body water, in general, human beings, 70% of the human body is water, as you know. From this total body water, 2/3 is within the cell, and 1/3 is out of the cell. That's extracellular. And from this 1/3, 75% of this 1/3 of extracellular fluid found within the interstitium, and 25% is within the plasma. So this Starling process balances the fluid within the plasma and the interstitium. So what are these forces? These forces are from the plasma side, or within the capillary. There are capillary hydrostatic pressure and capillary oncotic pressure. From the interstitial side, there is interstitial hydrostatic pressure and there is interstitial oncotic pressure. So these forces will balance the fluid between the interstitium and the plasma. When there is an imbalance between them, the fluid will leak from the plasma to the interstitium. That will result in edema or swelling of the body. So if we know this much, how do we characterize body swelling? So as I mentioned earlier, if the patient has generalized body swelling, which means if all of his body is swollen, always we have to know the pattern of the swelling along with its duration, how it progressed, because edema or body swelling is associated with these pathologies. One, the pathology arising from the heart, or it can be hepatic, or it can be renal, or it can be from GI systems. So if there are different pathologies within these organs, the patient may manifest with generalized body swelling. So the objective of the physician is to identify from which organ the problem is arising. So one way to identify this is knowing the pattern of the swelling. For example, in patients with heart failure or cardiac problem, they will have generalized body swelling, but the swelling usually starts from the leg and it will progress up. This is because the major imbalance on the Starling force in heart failure is due to increasing capillary hydrostatic pressure. How this capillary hydrostatic pressure increases? It's easy. The heart is in failure, so the heart is not capable of accepting more blood from the venous system, because even the heart is unable to pump what you have collected so far. So there will be an increase in the venous system. That will increase in the venous system, then it will be the increasing pressure on the venous system will be transmitted back to the capillary. So the capillary pressure, hydrostatic pressure will increase, so the fluid will leak out interstitium. This will be supported by the gravitational force. So for that reason, it is gravitational dependent edema. That's why patient with heart failure, the swelling begins from the leg and progress up. But if the patient is bedridden, do you think it will start from the leg? No, it will rather start from the backward, from the sacral area. Because as I mentioned earlier, it is gravity dependent edema. If you consider patients with underlying hepatic diseases, patients with chronic liver disease, the swelling usually begins from the abdomen, with ascites, and it may progress to involve other body parts. You see the pattern, the difference? And patient with nephrotic syndrome, that is one of a syndrome that wastes proteins through the urine. So the oncotic pressure, plasma oncotic pressure is decreasing, which is one of the Starling forces which regulates the fluid balance. So decreasing oncotic pressure causes swelling of the body, and usually in this patient the swelling begins with puffy face or swelling of their face. So the pattern of the body swelling is very, very important, along with the progression and the duration. The other thing is how the patient notices the swelling. Yeah, we have to mention it on our history. For example, once the edema starts from his foot, the patient may notice it because he is unable to wear his usual shoes. So if he is unable to wear his shoe, then he noticed his leg is swelling. So on history, swelling of his leg because he was unable to wear his usual shoe. Or the patient noticed his abdominal swelling because he is unable to wear his usual suit. Okay, now let's see one sample history elaborating the characterization of a patient presented with a chief complaint of generalized body swelling of 1 month duration. So under the history of present illness, and we can characterize the body swelling like this. Mr. Muhammad presented with generalized body swelling of 1 month duration, which started from his leg, and 2 weeks later it progressed to involve the abdomen, and 1 week later it involves the whole body. He noticed the swelling because he is unable to wear his usual shoes and clothes. So from these statements we can understand that the duration of the swelling is 1 month, and it explains sequentially how it progressed, starting from his leg, and after 2 weeks it involves the abdomen, after 1 week it involves the whole body. So the progression of the swelling is very important because it will give us a clue for the underlying pathology. After explaining the body swelling, then we will list out the associated symptoms the patient has, so that we can specifically narrow our differential diagnosis, or on which area or on which organ we should focus. So associated with the swelling, he has exacerbation of shortness of breath, he has PND, orthopnea of two pillow, palpitation, easy fatigability, nausea, and loss of appetite of the same duration. So that from this brief history we can understand that the underlying pathologies, most likely it arises from the heart or cardiac pathology. So this is a way that we should express the body swelling.